How you doing, everybody? Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. And today we're going to talk a little bit about my history and also the successes that we have in our clinic and why we have the successes that we actually have. You know, my history of working with fibromyalgia patients actually starts back in 1990. For some people that have gotten my book and have read it, I'll do a little precursor, so to speak, and review what you might have read. But in 1990, I unexpectedly was doing some paperwork at my desk, and in the afternoon I got a phone call from a lawyer who said he had an accident patient, and the patient was one of mine. I hadn't seen her for quite a while. She was a college student, as a matter of fact. And after the auto accident, apparently she contracted something called fibromyalgia. He asked if I'd ever heard of it, and I said, well, I've heard of the word. I said, but I don't know that much about it. He said, well, try to get some information. He said, because we're going to go to trial, and I need for you to testify. And I said, that's kind of interesting. Why is that? He said, well, you were the last one actually to see her before her accident, and so we need to have the history of what she was like prior to that and so forth, and any information that you could have concerning fibromyalgia, especially if she had it prior to the accident. And so I went to the University of Arizona Medical School. At that time, you couldn't Google things in 1990. And I asked if they had any information on a paper on fibromyalgia. I had used their services before, and they said, yeah, as a matter of fact, there's a research paper that they had. And so for, I don't know, maybe $8, $10 that I sent them, they sent the paper up, and I started studying it. Well, it was about 15 pages of the smallest print that you could believe, and it was on a research paper on, actually the first one on fibromyalgia, and that not only named it, but also a lot of the symptoms and what you would expect as far as a fibromyalgia patient. And so I used that in the court case. I was the last one to speak. It was like 2.5 days, Friday afternoon. And so when I went in, most of the jury was, shall we say, comatose or asleep, primarily because they were more interested in what they're going to do Friday afternoon and what was a chiropractor really going to say on a case like this. But anyway, I was last to testify, and so introduced and so forth and so on. Some basic questions, and then their lawyer got up and started asking me questions. The usual and customary playing mind games, never called me doctor, and every time I gave an answer, he would look at the jury and kind of smile and snicker and things like that. It was kind of interesting to see the reactions that he was having. He was kind of a short guy, and he pranced around a little bit. But anyway, he asked me a question, and there's an old saying in law that says, you should never ask a client a question unless you really have a pretty good idea what the answer will be, especially if you're in a jury or in a court case. And so after I had answered one of the questions that he had given me from information on that research paper, he said, and where did you get that from, your chiropractic school? And I said, no, actually from the research paper from the American College of Rheumatology, 1990. I said, it just came out on research on fibromyalgia. I thought he was going to have a heart attack. And he went to the judge and said, hearsay and all the different things. And the judge asked me if I had any proof on that. And I said, yes, I have a copy of it in my valise, and I have extra copies for the jury. I was thinking far ahead. Well, this lawyer almost had a heart attack, I swear, when I did that. And so you give the copy to the judge, and he looked at it, and I swear there was so much silence in there. It was eerie. And I looked at the jury, and all of them, all of a sudden, from that sleepless, comatose type thing that they were in, all leaning forward, looking at information concerning this research paper. Apparently, I was the only one to bring in research on the condition of fibromyalgia. All the other doctors, and they had the alphabet from A to Z, different doctors came in and said there was no such thing, and it was hearsay, and she was just really in it for green salve, better known as money, for her condition. And so the judge looked very, very closely at the paper, and after, I swear, it seemed like an interminable period of time, maybe just a minute or two, he said, this is a valid research paper. He said, you want me to make a copy of these, or do you have those copies? I said, I have them right here. Give them to the bailiff. The bailiff gave them to the jury, and they lapped them up like milk in front of a cat. It was fascinating. And he turned to the judge, excuse me, he turned to the lawyer from the other side, and he said, do you have any other questions for this doctor? And he just looked and shook his head and said no. And he went and sat down, and he asked my lawyer, or a patient's lawyer, I should say, if there were any questions. And the lawyer from her side said, I think he said more than enough, haven't you? And the judge said, yeah, he certainly did. And so he excused me, and as I was going by, the jury was all smiling and actually almost like congratulatory in their way in which they treated me, because I had given them something that they could actually use that was valid research on this situation. And they're very, well, that was, like I say, the first research paper on fibromyalgia. And so they were interested just as anybody else. Well, believe it or not, the jury case came back and she won $125,000, which was at that time in 1990, a huge amount of money. And there was some punitive damage in there because the other side tried to prove that she was just in it for the money. And that was a very large case, and to this day, I think it's the largest case for a fibromyalgia case in itself. So it's sort of like I was the pioneer. So it was the beginning of my journey through the jury, so to speak. From 1990 then until 2000, I tried to work with fibromyalgia patients with the understanding of the research paper, and I used everything at my disposal, and that which I was trained and certified for: chiropractic, physical therapy modalities, acupuncture, cold laser, whatever was available. I tried various forms of exercise, anything that came out with as far as the studies itself on fibromyalgia, which were very, very few at that time. But anyway, bottom line is that I started working with fibromyalgia patients, and I did help their symptoms, but not really their condition, okay? I helped many of them in many ways, but many of them because I didn't understand that much more about fibromyalgia other than to treat it what I had available. In the year 2000, which I was about ready to give up because I was very frustrated not being able to work with patients successfully and helping them through their condition. In 2000, two things occurred literally within months of each other. A lady actually committed suicide in Phoenix. She was going from doctor to doctor and emergency room to emergency room because of the pain that she had. But all the tests that they did were not successful, and so they thought really she was kind of crazy. And they tried to send her to a psychiatrist, they drug her up, so forth and so on. This lady was 30 years young, married, 2 children, and so with the heavy level of frustration, she wrote a letter, and she drove out and made breakfast and lunch for the kids and her husband, drove out to I-60 and got out of the car and walked in front of a semi and committed suicide, killed herself. In the letter itself, the letter stated that she wasn't crazy and she was in a lot of pain. Nobody would be willing to help her, and so she decided to end it all because she knew she wasn't crazy. It really hit me to the heart for someone that was not being helped in our science of health, medical science. And then literally a couple months later, I received a postcard about a fibromyalgia convention being held in Phoenix by this doctor called Dr. Saint Amand from California. And in effect, it was Friday, went from Friday afternoon to Sunday afternoon, Friday afternoon, all day Saturday, and then Sunday morning. And so I went to see what this was all about. And it was held at a big convention resort, so to speak, in Phoenix. And when I got there, I was just totally surprised by the number of people that had shown up. There were close to 3,000 people that showed up for this convention, of which I'd say about 2/3 were patients and the other third were health providers, everything from doctors to a variety of health providers and assisted care people, nurses, therapists, you name it. But what I decided to do, since I'd never heard of this person, again, Google was not quite in existence yet, and getting information out was sparse. And so what I did was I spent time talking to these supposed patients, and they were telling me about this doctor who was just like a miracle worker, where they couldn't stand up, they lost their jobs, they were in bed, or they were in a wheelchair, and so forth and so on, and how after their treatment they were able to get up and actually live a normal life. And I just couldn't believe it, because I'd never heard of this individual before. And so that was Friday. At the end of the day, I finally introduced myself, and I followed him around and his assistants all day Saturday and Sunday, and I learned his program or protocol, which made a big difference, because as soon as I went back and started using his protocol, I've changed it somewhat, only in respect that a little bit more dramatic as far as the inflammatory aspect of controlling the inflammation of the patients. But other than that, I followed his program and protocol step by step. Now, this is what we're talking about as far as patient success in here, because I went from just working with symptoms to actually condition. See, this Dr. Saint Amand is not only MD, but also he's a researcher out of UCLA, and he has fibromyalgia. And it was adversely, obviously, affecting his ability to work with patients. And so he started doing research, and what he did was he found that there was a genetic marker that people are born with. And this genetic marker adversely affects the body's ability to function in many different ways, and we're going to get into that in just a little bit. If you have fibromyalgia, you know it's the worst thing. It's like having the flu 365 days out of the year, but it moves all over your body. And it can range everything from hair loss to skin rashes to irritable bowel to you name it. Just a little bit of everything. Headaches. No two people have the same symptoms with fibromyalgia. And that's what makes it so difficult for fibromyalgia, or for patients to deal with fibromyalgia. But I found that in trying to get patients to sign up for the program, I tried to sign up everybody, and I found that I was making some mistakes. And the mistakes were that patients had already tried a number of different things, and they came in with the idea that, okay, well, I'll try it and see what happens. That's like saying, okay, I think I've got a cold coming on. You're already sick, okay? I think I have the flu. You already have the flu, okay? Your mind is a fantastic thing, and it can talk you into a number of different things. So I started actually mind setting patients to say that, look, you just can't try this, okay? You want to really get into it and make sure that you go 100% into this. If you do, you'll be successful. So I concentrated on things like I embrace, I accept, I am powerful with this, because a lot of patients had already given up. So it wouldn't make any difference if I was walking around with robes on and it was a miracle worker. If you don't think you're going to get better, you're not going to get better. And so the mindset on people, I assent, I believe, I know I can do it. I am relentless. I'm determined to succeed in this. Plays an important part in our program. If somebody comes in nilly-willy, they don't really think they want to do it, well, they're not going to succeed. They at least have to have the drive to want to succeed. But isn't that true in just about anything? I used to treat with acupuncture patients to stop smoking. And we were very, very successful. But a patient walked in with cigarettes in their hand, or in their pack, or in their in their shirt pocket, or in their purse, and they smelled like they had smoked just before they came in. Chances are slim I'm going to help them, regardless of what I do, okay? Because they don't really want to stop smoking, all right? So, and I'm not saying that our program is all mental. That's not it, okay? But I am saying that one of the most important things of our program is mindset in itself. You have to have a little bit of PMA, something called positive mental attitude, regardless of how negative everything has been. And we try to instill that regularly into our patients, all of them, not just fibromyalgia, but anybody that comes in that is having health problems. What we do is we concentrate on the fact that if you follow the program and you do not deviate from the program, okay, you'll be successful. But if you deviate and get creative, you're going to fail. That's the most important thing that patients have to understand. So to get started with, we realize the fact that a lot of patients, when they first came in, we would really check with them and find out if they really and truly wanted to go into this protocol. So what we do is we do a startup. We do an explanation of the program, explain to them what it entails, so forth and so on, and then we would send them home. We would say, okay, let us know this week as to whether or not you want to get started. And that way, we're not just automatically starting someone. We wanted those people that really wanted to succeed and spend the time to get into this. Because again, no pills or potions or miracles that I could produce from them would be successful unless they wanted to get better in itself. That's extremely important. And that's true with anybody out there. You have to want to really get better, okay? The woe and me stuff, I understand, okay? And everybody has conditions that they get frustrated and upset about, but you also have to have PMA, positive mental attitude, that'll help you along with this. That's really important. You know, another thing is that they think this is a female condition. Well, it's really not just a female condition. It's a combination of male and female, of which, because most females spend time at the doctor versus males, you'll have more diagnosed females than males. But the bottom line is that we've found just as many males as females, but there's an ego thing with males that causes them not to go to a doctor. I can work my way through this, and so forth and so on. So the protocol is rather simple. It's almost like a take-home type thing. It really doesn't include chiropractic per se, which my brethren don't really like for me to hear that. We take care of secondary conditions, and oh, by the way, every fibromyalgia patient has secondary conditions. I've never met since 1990 a fibromyalgia patient that just has fibromyalgia. You've got osteoarthritis, rheumatoid arthritis, MS, Lyme, lupus. You have a variety of different conditions, diabetes, high blood pressure, so forth and so on. All of these are adversely affected by fibromyalgia, but we work our way around and through that. We concentrate on the fibromyalgia aspect, and when we do that, we actually help the other conditions that actually start to get a little bit better. Not that we're reversing osteoarthritis, rheumatoid arthritis, but because fibromyalgia causes so much pain, we're reducing the pain and the symptoms that you have, or whatever they might be, that will actually help you through this. So the next thing we're going to talk about, since it's way over time, is we're going to talk about the protocol and program and what it entails. So keep that in mind. I'm going to deal with that next week. Ken Muich, that's in Chiropractic Clinic, Fibromyalgia Wellness Center. And we're going to deal with the program itself and the steps that you need to take for this. Keep us in tune. If you have any questions, anything else you want to do, keep in mind these are being saved and will also be put on YouTube. Thank you very, very much. Have a great week. Look forward to seeing you next week. Bye-bye.